So my name is Femi, and I work with Farmerland. Our big mission is to enable easy access to affordable animal health care in underserved communities in Africa. We are a strong team of diversified professionals, leveraging the use of technology to aid the quick and cheap distribution of quality animal health products in underserved communities. All right, so in summary, what we do is that we're making in Africa animal health available, accessible, and more importantly, affordable. Here is a story. Meet Mrs. Rosalind Menegbe. Now, somebody gave Mrs. Rosalind our contact a few months back that we are one of the best platforms that she can book her day-old chicks. Day-old chicks are just the little picture you see underneath Mrs. Rosalind. Mrs. Rosalind, she's age 56. She's retired. And then she invested about $3,000 of her life savings to raise these 1,200 beds. Unfortunately, at about 5 to 6 weeks of this investment, she lost all due to fake and substandard vaccine she bought from a nearby agro vet store. I remember going to see Mrs. Rosalind with a member of my team, and I saw the devastation in her face. And the concern was that how do I pick up from where I have dropped the ball? Fortunately for her, Farmerland came to her rescue. We supplied her fresh beds at no cost. And now she's a proud owner of a farm, a layer bed that is currently laying. Sadly, in Africa, there are millions of Rosalind out there. The continent, Africa, loses in excess of $3 billion annual income for farmers from diseases that are highly preventable. Usually the high cost of animal health products, the poor or substandard medicine and vaccines that are almost always at the arm's length for all farmers. And sadly, the broken supply chain and the poor animal health infrastructure that we have in Africa has worsened all the situation. There are more than 50,000 agrovet stores in Nigeria, scattered around various local communities with livestock and pet. These stores are designed unintentionally to cater to animal health needs of their local community. They are fragmented, owned by young professionals who lack adequate trainings and fundings needed to get the necessary quality animal health inputs they need to serve their immediate communities. The broken supply chain and abundance of fake and substandard medication worsen this and drives the average cost of quality inputs even higher. Our insight is that the African distribution model for animal health products is largely fragmented, split into tiny little shops with zero economics of scale. And we realized that by inviting these tiny little shops into a growing network of animal health stores, we can drive costs down, fortunately, by up to 30% and guarantee qualities all the time. Our solution, therefore, is built around a system that leverages technology to aggregate the animal health needs of agrovet stores nationwide and deliver it quickly and cheaply through our network of distribution centers while maintaining the best quality. How does it work? I want to quickly take us around our user journey. So meet Mobile Vet. Mobile Vet is owned by Mark. Dr. Mark is a 32-year-old veterinarian in a small town called Lube around Federal Capital Territory in Nigeria. Mark has set up a local animal health stores to help his communities with the necessary inputs and services needed for their livestock and pet. Mark, first of all, lacks adequate funding. More importantly, he has no support. He also uses his business also as a source of livelihood for him and his young family. The problem is that Mark is trusted at being part of a community, but 65% or more of the time, he disappoints his loyal customer by not regularly having what they need. So most input suppliers consider Mark's purchase volume to be very small, hence the constant delay in his supplies. He even gets charged more. So Mark's solution is to travel to an urban store, buy at a higher price, spend high logistics costs for a small amount of input, and can make a significant margin to sustain his business. Mark contemplates closing down. One day, Mark had a stroke of luck. Mark receives a call from Nancy. Dr. Nancy is a young veterinarian who operates in another community. They were classmates. Nancy shares her amazing experience and advised Mark to sign up on farmalert.shop to set up an account with Farmalert. Dr. Nancy is a part of the Farmalert trusted network of brand champions who actively spread the news of our distribution system to colleagues, helping farmers and pet owners. Of course, Dr. Nancy gets a commission for every successful referral. Mark signs up immediately. Mark makes an order that is within his budget with a smartphone and get it within 24 to 48 hours at his doorstep, cheaper, faster, and guaranteed the right quality. Mark now has more inputs readily, on time, at a better price. He can better help his community, commits to improving the overall and improves farmers or pet owners' livelihood as the case may be. Mark is happy. He makes better income. He eventually becomes our brand champion. That is the Farmalert story. Our competitive advantage. Without us, you need the average agrovet needs an average of $2,000 to buy from one brand or one manufacturer. If you shop on farmalert.shop, you need just $500 to buy a little of all the brands. Without us, you will need to have the contacts of 10 to 30 manufacturers to get all the needed brands. If you shop on farmalert.shop, you just need only us to have all your needs met. You mostly handle your logistics without us, which are often difficult and very chaotic. With us, you get your product at your doorstep, no hassle. Buying from a third party because you're low in cash opens you up to fake or substandard product. No worries, all products are vetted by us. I have 15 years of practice experience and we have veterinarians working in the team verifying products quality. Without us, you have to call and keep calling until all your needs are met. With us, you just need a smartphone. We do the calling when we receive your order via our platform. Without us, you spend and keep spending. Right now, we are currently experimenting the Buy and Save project, where we return 1 to 2% of all your purchases per quarter as savings to you. Isn't that just wonderful? Our goal is our key satisfaction index: quality, convenience, and price cuts. What we track as our social impact model, the number of agrovet stores we're supporting, the total number of farmers and pet owners they serve directly and indirectly. We're equally tracking the total number of livestock and pet saved, but more importantly, we are also tracking the impact of our solution on the overall livelihood of farmers and pet owners nationally. Gladly, since 2019, the total number of animal health professionals we're supporting is over 200 as of now. Over 10,000 pets and pet owners and farmers that we interact with directly and indirectly. More than 100 million worth of livestock has been saved through our intervention, and the average impact on their livelihood is over 20%. Our vision then is to become the #1 animal healthcare brand in Africa by 2030, aiming to leverage technology to power the quick distribution of quality animal health products cheaply across Africa. Pauline, should I go over our revenue?
Yes, you can go on. Go for it.
All right. So we have grown exponentially. In 2019, when we started off, we had a revenue of $100,000. 2020, we had a revenue of $450,000. As of 2021, we doubled our revenue to $1.1 million. Fortunately for us, last year, we were able to record a $2.4 million in annual revenue. Our forecasts are a little bit fearless, but realistic. We're predicting a revenue of $8.5 million in 2023, $15 million in 2024, and $25 million in 2025. So far, January and February alone, we've achieved almost $600,000 in annual revenue. We're creating a minimum of 3 distribution centers on or before June 30th. But with the investment we are seeking, we could take this up to 10. Our business model is simple. We charge a commission of 5 to 15% for every successful sale. This commission could go as high as 30 to 35 upon scale. What we are seeking is an investment of $500,000 convertible loan to help us quickly scale from 2 distribution centers that we currently have to 10 distribution centers by July 1st, 2023. We've already marked over 50 hotspot locations because of our intel that we could locate these distribution centers amidst clusters of animal health stores serving their communities. Raising these funds will help us serve our rapidly growing demand for our services. The loan amount we're asking for is $500,000. The tenor is 5 years. The loan interest we are offering to give is 13% per annum. But just to say that this loan is a convertible loan, our financials are looking good. They could even look better. We offer currently an IRR of 24%. Our conservative valuation as of today is around $10.2 million. The total amount we need to raise to achieve the full scale of what we intend to achieve is around $3 million. I'm gladly to say, after raising this loan, in another 12 months, we're coming back to raise an average of $2.5 million in equity. Right now, we have stuck to a loan, but we are also very open to convert the loan when the time comes, when we're raising for equity. Our financials are looking great. 2022, we had a record of $2.4 million. And we are hoping that by 2028, our annual revenue must have risen to $37 million. Glad to say that we are also currently very profitable, and we are working on our skill and our operational excellence to ensure that we improve on our profitability. We are also seeking a grant of $50,000 to train 5,000 farmers within the next 12 months. Education is a big part of growing our community and our impact. If properly done, it could deliver the most remarkable results. In partnership with eHealthNet, we are also introducing the technology to digitize farm paper records and use it as a source to track disease. It's our estimation that if we can raise this grant, or when we do raise this grant, over 100,000 livestock farmers and pet owners will be hugely impacted by the training and, of course, by the intel we will get by tracking sources of diseases. We see ourselves as operating as the central nervous system in animal health in Africa. We're doing the thinking, building the network, and with the help of independent animal health stores, we intend to reach every single farmers and pet owners in Africa. And we're inviting you to join our story. Our team is made up of 51 associates. We call ourselves associate, having picked an inspiration from Walmart. I serve as the founder and CEO. We have the general manager of operations with over 11 years experience in the commercial sector, commercial banking sector. We have a chief accountant. We have a chief technical officer who powers the platform we will use in aggregating the animal health stores. We have a marketing manager. We have a community engagement manager. We have a chief customer satisfaction officer. And proudly, we also have a corporate communication manager in charge of reaching out to all agrovet stores in the country. We pride ourselves that we are unafraid to try. The African market is a huge, huge market, worth billions of dollars. What we've begun, it's simply a seed to the future of animal health in Africa. And what we are asking you is to join our story. Let me, at this point, thank you all for listening and for giving us an opportunity to be more useful to our local community. While I await your questions, I will also await your checks. Thank you, and then thank you.
Thank you very much. That was great. You can leave that last slide if you want in, but we have about 15 minutes to ask questions. You can both ask questions in the chat. I will review them and make sure to pass them on to Kayode. You're getting some claps in the room here. It's a bit cold, of course, on Zoom. You can't hear it, but I think people are cheering you on from behind their screens. Thank you so much. This was very clear and very inspiring. Any questions from the room at this stage? Anyone who wants to either write something in the chat or want to raise their hands to ask a question to Kayode? Sorry, I missed this, but how many years have they been in operations? So a question from James. How many years have you been in operations?
All right, thank you so much, James, for your question. So as a vet, I've been a vet and I've been dealing with farmers for 15 years. We have a few of our vets also that have been in the community attending to farmers and pet owners. We bring in combined experience of over 30 years. But Farmalab began this in 2019 to have a structured approach towards intentionally reaching these farmers. And so 3 years for Farmalab, but a combined experience of over 30 years dealing with farmers generally. Personally, we have our community engagement manager, Dr. Tumsia, who also has been relating to farmers in their local communities. So all this combined experience, we all bring on board to form the solution we now proudly call Farmalab. Thank you.
Okay, here another question coming through from Pat A. Could this model be replicated to humans? That's a good one. Kayode, can you hear me? Were you able to hear
Yes,
that
I can
question?
hear you.
Yes. Could this model be replicated to humans? I think you're freezing. There are another 2 questions coming up, but Kayode, can you hear me? It seems like he's frozen. Unfortunately, let's give him another minute. Any other questions? Okay, Kayode has dropped off the call. Let's give him a minute to reconnect, giving you a bit of time to prepare more questions. We have 2 more questions here from Ederin Aderemi. Any option for farmers and pet owners without a smartphone and wants to access your service? Very good question. What is your service coverage in Nigeria? So
okay, all right. So, sorry, I lost you a bit.
You're back? Okay, great.
Yes,
So we have 3 questions for you, Kayode. The first one is, could this model be replicated to humans? We can start with that one.
So funny enough, we picked the inspiration from the human sector. So the human sector in Nigeria is highly organized, and they have so not entirely, but they have a central distribution system that guarantees also quality, but none in the animal health sector.
Excellent.
So we're probably just starting this in Nigeria, and we hope to scale this across the continent. So nothing yet that organized in the African continent yet.
2 more questions here from Ederin Aderemi. Any option for farmers and pet owners without a smartphone and wants to access your services? And the second question is, what is your service coverage in Nigeria?
All right, so now we are not directly, initially, when we started this model, we're directly reaching out to farmers and pet owners. We're able to create around 5 service centers to attend to farmers and pet owners directly. But there was a huge problem with that. And the problem was the problem of scale. Those service centers are very expensive. But more importantly, we have farmers and pet owners who needed our services, and it was difficult reaching out to them. Just like the case of Mrs. Roslyn I shared when I started. Our service center wasn't in our community. So just about while our team were brainstorming, because we saw the scale at which people needed quality at an affordable price, we realized that rather than opening service centers to attend to farmers and pet owners directly, why don't we support existing vet stores, agro-vet stores? And that was the genius idea. Because that we realized, again, that those agro-vet stores were having similar challenges. They lack funding, they lack access to some of these basic products. So we now said, if we aggregate their needs on a platform, use economics of scale to bring down the cost, offer pre-distributions and logistics to them, so that they can concentrate and serve the farmers and pet owners without any hassle. Because I'm a young businessman, managing various aspects of businesses are very difficult. You're looking at inputs, you're looking at managing your staffs, you're looking at your revenue, you're looking at your customers. It could be a lot. What Farmalert has done is genius. We took away that pain of sourcing the problems, sourcing their inputs from them. And just within 5 to 10 minutes, you could order your product, and within 24 to 48 hours, you have it on your doorstep, so that you could do what you do best, just serve the customer. And so right now, we are not directly building solutions for farmers and pet owners. What we are doing is building a solution directly for pet store owners or animal health professionals. I don't know if that answers your question.
And the second question was, what is your service coverage in Nigeria?
Sadly, we are still below 2%. But that also offers a lot of good news. If we have over 50,000 agro-vet stores that needs our solution, and we are just around 200, the more reason why we need your check today. We have the expertise, we have the model, a very scalable model. We can do so much more. And we are about the first experimenting with this. It's working, and I know it can work better with your support.
Thank you. And then we have a contribution here as food for thought in 10 years. For Farmalert, as they grow, is wildlife conservancies and working with governments, which has a lot of value even to local economies through tourism. So your model could also be scaled up for wildlife conservancies, which I think is
absolutely. Thank you for that part.
Mark, quickly here, how quickly and easily can you roll out new distribution centers across Nigeria? What does it cost to add a partner?
All right, so it takes us an average of 2 to 3 weeks, maximum 1 month. The good thing is that I operate in the government circle as one of the youngest board members of the Veterinary Council. And one of the key things we did was to locate, geomap most of the agro-vet centers in the country. We currently know where most of these agro-vet centers are. This has been a 2 years research for us. With fund, it takes us an average of 2 to 3 weeks to set up a distribution center. And it takes us another 2 to 3 months to get all the vets or all the agro-vets in that location sensitized and to use our products. We already have a very goodwill. Farmalert's brand has a very strong goodwill among the veterinary or agro-vet community. What does it cost to add a partner? Maybe, do you mean distribution center? It costs us an average of $30,000 to get a new distribution center set up, if that's what you mean, Mark.
Yes, so I was asking whether there's any sort of new build cost to building a center, but it sounds like it's mainly operating costs. Is that right?
So we try as much as possible as a business principle to keep our expenses very low, since our margins are still slightly low, which are going to increase within the next couple of 12 months or so. So what we do for those distribution centers, we hire a warehouse. we clean it up to meet up with our standard. Once we do that, we already have a relationship with almost 70 to 80% of all the manufacturers and importers, and they're already serving us. So what we just need to do is to ship products in there. The platform we use to aggregate these orders are just one platform. So it takes us an average of 2-3 days to add a distribution center to those platforms. So we're very agile, we're very fast. We already got this figured out. And with increase in the amount we're looking for, it takes us a month averagely to set up a service center and get it up and running.
Thank you.
Thank you. We have one last question, and then we'll have to stop here. From Siu Steve Taiwai, what is your average customer acquisition cost, ratio, if calculated today? Are you profitable in terms of unit economics?
Our customer acquisition cost is less than $10. And that's for the reason that we have been in the industry for a while, and also for my experience in the industry. Fortunately, we have the locations of where these agrovets are. We have their emails, we have their phone numbers. So we're not building this all over again. If we move into a community, we go directly. And because of our regular training in the veterinary community, most of them are already very used to the brand. So our customer acquisition cost is less than $10, because most often we go to those agrovet centers when we are starting up a distribution center to build up trust and then ensure that they see us and we can geomap also their location. We're profitable. Once we start a center, a distribution center, it takes us an average of 3 months to break even. And that's because it takes us that long to get our sales up. When we started the Abuja distribution center, the first month, we're already averaging around $50,000 to $60,000 in less than a month. So it takes us 3 months or so to get to an average of, let's say, $100,000 to $200,000, depending on the volume of transaction we're expecting there. So we are currently, all our distribution centers are currently profitable. And when we have some more, it won't take us 3 months to become profitable. I don't know if that answers to you directly, so.
Thank you so much for this explanation. Thank you to all of you for your questions and for getting Kayode to clarify a few points from his presentation. It is now time to move on to our next presenter. So Kayode, thank you very much. This was a great pitch. And for all of you who are interested to hear more from Farmer-led and to join this exciting journey to revolutionizing animal healthcare in Africa, we will make sure to put you in contact. AVPA, of course, is your lead contact here, but we would make sure that you can get in contact with Kayode to get on this train as soon as you can, because it's now or never, as Kayode has said. So thank you so much.